participants. I can see a number of people from Railway Ministry. In fact, right now, until now, we are listening about the treatment of eye. I think it is one of the basic job for any ophthalmologist. Simultaneously, we have big responsibility to give a very fantastic, fit person to government organization. And it is not our duty only, it is a legally foundation. I thank Dr. Tyagi that they have given some introduction of our ministry. Our medical examination bit tough. We are very particular to stick the parameters guideline issued by the Ministry of Home or Ministry of Railway. Just for the information, I would like to tell you here that in 2001, when the metro was operating in the country, I was the first examiner who examined more than 1,000 people who are going to Japan to start and run the metro first time in India. That in Delhi, I tell you. So, if I just look my experience regarding this field, I have not really counted, but I can just assess that more than 1 lakh people I have examined my life. I am examining from last 20 years, and not only that, being ophthalmologist and senior ophthalmologist, I became the coordinator of number of ophthalmic examinations and medical examination carried out in my hospital. So, the thing is, normally we think that what the existing parameter we are having to guide, to give the fitness to our employee or our candidate who is coming like class 1 officer or maybe an employee, are they correct? Because a lot of advancement is coming every day. So, are we doing justice with that? So, just for, as Dr. Gajendra had rightly said, that I was the member of more than 4 committees to introduce newer technologies, to change the guideline, to implement. And I tell you, it is very difficult to get it approved from the number of different directorates who are really not doctor. But they all concerned about the safety of the employee, safety of the public. I mean, it's our responsibility. We are carrying huge amount of money involved in train operation, like in other organizations, and huge public safety. We get a lot of bad name if something happen wrong. So it's our legal duty that we should select a man as per the classified guidelines, the criterias, and implement them strictly. So can we change the guidelines? Can we change the criteria what we are following right now? So that's my topic today. So what is the need of a medical examination? Here I would like to tell you not only the government organization who are doing medical examination, but now number of private hospitals and corporate are also coming with us. So they are also doing medical examination. They are doing very well. We have not found any failure till now. And their instrumentation, their workup, their examination, everything is as per the laid down guidelines. So it is an essential requirement for all government job, for other job, to decide the fitness. And fitness has to decide as per the job. A single fitness criteria cannot be given to different kind of job profile people. A pilot, loco pilot in railway, or a commercial pilot in aircraft, and a person who is working on the ground cannot have a similar parameters. We have to make the difference. After all, everyone should be given the chance to work, to earn his bread and butter. So we have decided the parameters should be a bit different. And the fitness, once you do your work honestly at the present, and just keep a word in your mind that you are giving the fitness for future also. Otherwise, the patient, the candidate will not serve effectively in service, and the organization may bear the early pension in any case of eventuality, or to reduce its status, what you call decaterization. So what involved in medical examination? We start from history, family history, all kind of disease, what a person can have the word with him, the examination part. We have to look the physical parameters, what are the guideline has given to us, few of the laboratory tests and few of radiological tests, that we have to include in that. So this is all. So good mental and physical health, age is a good criteria. You have to have a proof of age, that we have certain age limit, we cannot go beyond that, not less than that. Height, chest girth, chest expansion, there are some physical parameters which are normally almost same for all kind of job, technical, non-technical. Some relaxations are here. Few governments are giving relaxation to certain categories, certain tribals, certain races. Hearing test, yes, it has to be. But what I have seen, that including all parameters, ultimately failure, fitness, and fitness come somewhere at the vision. So vision is very important part, and that's why we, the ophthalmologist in our organization, have a very important role to decide the fitness. Everything come to us. That's why I was always been nominated as a member of all this kind of committee as a coordinator. So normally, if you look for the total parameters for all kind of job, they are broadly divided into two: the technical category and non-technical category. When I was going through, first time I know that the Indian administrative service people who have lot of field job, lot of rough life, comes in which category? Are they in technical category or in non-technical category? It is in non-technical category. So you may not believe it, I also. So non-technical category parameters are quite low. They are quite different, quite sedentary in nature. But for technical category like IPS, we need a very perfect man. And the criteria are bit different. So that is the things which we have to come once you come across about it. So acuity, when we talk about the vision, should be 6'6", 6'9", 6'6", 6'9", or 6'6", 6'12". I mean, these are some criteria when we want to have a best vision. And the best vision means unaided vision for some categories. In few categories, we have given permission that patient, the candidate can be recruited with the power of ±4 diopter. So here, I will tell you that aided vision and unaided vision are quite different. In few categories, we don't allow any glass. Like aided vision, just like a hearing with aid. So there is a gross difference. A normal hearing and a hearing with aid is different. So here also we found in few category of services, glasses are not permitted. Any corrective surgery also not permitted, right? But we found that from which area, which part this 4 diopter came. There is no scientific base of it. I have not found any document of it. That why you come out the some kind of figure of 4 diopter. As per literature, if you go through, as an ophthalmologist, I can tell you that less than 6 diopter, the chance of pathology of IP are very, very rare. So this can be increased up to 6 diopter if you are permitting glasses. And there is no harm of it. And with making this change, you can have some kind of category of people who are being debarred to joining the jobs can be accommodated. So this change we recommend that we should done, and it should be accepted. Contact lens. Right now, the contact lens are not permitted. And we know as ophthalmologists that vision with contact lens is definitely better than glass. A vision with glass having lot of restrictions, lot of aberrations, the field is small, cosmetic I will not talk, but definitely the vision with contact lens is better, and there is no harm. If you have to plant some riders, you can allow it. But right now, government has not. Refractive surgeries, right now there are no. Any IPS or technical people cannot be taken as a person who is having underwent any of the refractive surgery. So we advise that refractive surgery has a now sufficient standing in the market. It is US FDA procedure, and if done with a caution, done with a proper workup, I don't find any harm with it. I am doing refractive surgery from my patient from last more than 10 years, and at least I have not found anything wrong because of it. There are so many other problems which can arise in the life of anyone, but I don't find anything wrong that person underwent some kind of refractive surgery and landed up the problem in eye. Because we always believe a proper workup before putting patient of refractive surgery. So that we have suggested. Intraocular lens. It is worth sharing here for all of you that before 2001, the Ministry of Railway has not permitted their drivers to work of the train with a intraocular lens. We made the then Director General, who was quite intelligent man, we made a committee. हमने सारे patient, a driver who is having vision 6'9", that is our required standard, having a cataract exchange, using glass of 4 diopter or 3 diopter, If you compare this vision with the vision of a person without any glass, a good intraocular lens, with good surgery, why he should divide? A person who recruit in railway at the age of 25 years and having a huge experience of operating trains, diesel, electric, more than 150 kilometer and having a good experience, we just divide because now you have a cataract, you have gone for cataract surgery, you have a good 6/6 vision, your brightness is okay, your contrast is good, but we will not allow because guidelines are not there. So we made a committee. I did myself the foot plating. What you call foot plating? You have to stand with the driver, and you ask the driver that you now tell me your speed. It is 170 kilometer per hour, and we have a man with us who is having a intraocular lens in both eye and said, you please find out the signal is coming. You have to tell us whether it's green or red, and we compare with the person driver who is driving the train that who will speak first, this or that. And we find the person who are having intraocular lens in their eye are very prone, very clear, without any hesitation in different climate. Rainy season, foggy season, everywhere we have checked. And then we submit the report. Sir, this procedure is absolutely okay. We have practically checked it and should be implemented. And it was given. Since then, we are having all drivers with intraocular lens. They are running all kind of train. So this is our achievement. Thank you very much. So I thanks Dr. Tyagi that he has made a lot of sensitization of the color vision. I will present little different manner, almost same because can't change the basics. So basic purpose of examining color vision to rule out the congenital color vision, right? So there are acquired color vision defect also. I don't not say that, but majority. But my purpose, my job is to rule out the congenital. And congenital is mainly the red green. Otherwise, it had a lot of other variation, but majority, I'm talking of 8% population who's having this kind of deficiency, and they have different grades. Red, green means they are not able to see red and green is not correct. They have some variation. Their identity is different. Their sensitivity is different. So for that, we have to check it. Right now, Dr. Pariyar is here. They are having some more grade than us. They are probably have 4 grades of color vision. We are having 3, like high grade, low grade, and no color. So like these have 3 categories, and we are having a different equipment to check it. So what are the equipment available with us to check this very important aspect of medical examination? So first of all, you can say it's the anomalous scope. You can see the figure over here. It is one of the wonderful equipment and it's not very new. It was invented somewhere in 1907. The basic principle of the anomalous scope is based on matching of the colors, right? It is mainly for red and green, but new anomalous scope are available which are meant for distinguish the color vision defect of yellow and blue, right? Second, Dr. Tyagi has already mentioned, it is a pseudo-isochromatic plates. They are also invented little late in 1917. They were invented, they are in practice, they are in use. And the gentleman was Shinobu Ishihara. What they did that they made a static confusing plate points. इसका जो principle है, that is co-punctual points कहते हैं इन्हें. So they normally fit this kind of lines, which is little confusing line कहते हैं. So anyone who is having defective color vision will get confused and read this figure differently. So that is the idea. And it is very popular, very common, and probably all government and private sector are using it as. There are other pseudo-isochromatic plates. They are also, they can detect even yellow color, blue color, like HRR. They are also one of the pseudo-isochromatic color plates. But it is very common. They contain around 38 plates. And basically, अगर आप देखें, out of 38, there are 4 types: vanishing, hidden, transforming, and classification. Vanishing means there are around 8 plates. A normal color vision person can read it. A color blind will not read. So color is vanished. Hidden, it's different. A normal color vision person will not read it, but a defective will read something. Then transforming figure will transform. A normal color vision read something different, a abnormal read something different. And classification, where we can divide it is red color defect, or it is green color vision defect, like that. One is very popular like D15 or France Bird 15. This total category known as arrangement pattern. They are also working on the same principle, but here the points are dynamic. You can shift the plate. In isochromatic color plates, the points are fixed. Here they are dynamic. So the candidate has to arrange these dots in a particular pattern, right? Then laltens. Laltens are basically in railway. I mean, they are designed by railway people quite long back because their basic principle, they simulate the signals. They are monochromatic colors. They have the filters inbuilt. Basically, they are designed to find out the red color, green color, yellow color, and white colors. Examined from the distance of 15 meter, 15 feet. 4.5. Yeah, 15 feet. They are not very good tool to find out the different color vision defect, but it have a very excellent occupation suitability. I will just show you in a this is a table I have made, all available kind of color vision test. So here you can see the Anomalous Scope. It's having very good identity of the color vision defect. It has a very good ability to detect and classifying the color vision defects. Grading and severity can be made very well with the Anomalous Scope, but it have almost negligible occupational suitability. Same thing with the plate. They are also not bearing very occupational suitability. Arrangement had good occupational suitability and Nishara has the best. Lalten had the best. So basically then we have to decide as per your requirement what guidelines should frame to detect the color vision examination for the candidate and employee who are coming to you for this problem. So color vision should be examined in all categories. EGL and other laltens should be replaced with the newer modalities. What we have examined now, lot of new modalities are coming. Digital color vision tests are available, they are computer based, but their basic problem yet we have found that they are not fully calibrated. After all, we are having a lot of responsibility of the society. So whatever modalities we will introduce should a foolproof system and better than the existing, right? Still, a lot of literature you can find that Ischara, just to screen the color vision defect, have a 90% sensitivity. So you can go ahead with it. Field of vision, lot of things. Right now what we are doing when a candidate comes to you for examination, a basic part of field has to be assessed by the examiner. So confrontation system is going on because it is simplest, available everywhere, but we don't find it have much sensitivity, and we requested that it should be replaced. And if selected or doubtful patient candidate where you need, should be examined by the automatic parameter which had very high grade sensitivity. So contrast sensitivity, we advise that now we are having different scenario of work. The trains are going to exceed the speed somewhere around 200 km per hour. The reaction time is less. So contrast sensitivity should be good, and it should be a part of examination, should include intraocular tension. You must have listened lots about it, that beyond 40 years of age, the glaucoma normally exists, and being asymptomatic disease, hardly anybody complain about it. But for a medical examination, we should routinely examine the intraocular pressure of all people who are reporting to you as a candidate or as an employee beyond 40 years of age. Slit lamp examination, it should be done. It should be done with a proper slit lamp, like it should be a good quality slit lamp which can give you the total information, and if possible should have a recording facility. After all, it is a legal problem. We have to keep a record of everything. Fundus examination should be done in detail, and all important examination report you should record in a soft copy or a hard copy in a future reference. Because if anything reported after 20 years back, a primary examiner has to have responsible and may be asked. So it is our duty that we should keep all the relevant record, what we did and what was our basis. Squint, madam has very clearly said, though we are not recruiting children, but somebody has given the photograph of it. Squint of any kind, even the latent squint, we have to examine these patients very in detail because our job is slightly different. We have now, at present, anyone who is having any evidence of squint is unfit. Unfit means total unfit, not even temporary unfit. So we have asked the administration that at least some category of people should be given a chance by giving them temporary unfit. They should go and get a treatment, surgical or whatever available modalities, and they should be re-examined at a fair course of time after 3 months or 6 months for deciding their fitness later on. So a fair justice to be given to this category of the people who is having unfortunate this problem, but their job should be secured if they are getting fit, right? So that we have suggested. I mean, these are the new parameters what we are suggesting in the present scenario. These are the part existing with us. How many doing fogging test? Anybody doing medical examination except railway? Oh, you are doing, okay. So fogging test means you have to relax the accommodation. So we rule out the people who are having the facultative hypermetropia like that. And these things are not existing. I have seen practically, I have examined so many examination centers and asked about this procedure. Nobody is doing. Fine. And वैसे भी hypermetropia बहुत कम होता है. Myopic vision is also one of the clue in which we have to check the glare, and it is also not existing. I mean, the things have been changed. So we requested that these parts should be removed which are not practically possible. So what are the challenges to examiner? We are using Landots vision test. Nobody know about it. Landots dot basically a C kind of structure graded from 66 to 660, and a assistant has to rotate its direction up, down, left, right, and a candidate has to visit at a distance of 20 feet and has to give the answer which direction this C is, and then we decide that what kind of acuity is varying. But it has a lot of problem inside. I have seen a number of places these Landot dots are not totally calibrated. Lot of tempering is there. So if you just open their mouth little more, its sensitivity goes down. So we requested that these should be replaced with the digital, which have a proper background. They have this calibrated size, and they are not basically depend on the assistant, because there is some chance of problem can arise. Borderline defective color blind, they are definitely problem. So if two separate examiners are conducting, they found that the interpretation are quite different, and these kind of interpretation are being challenged in the court. We found that somebody get unfit from our ministry, go to the other government hospital, getting a certificate, sir is colorblind, color vision is absolute normal, and one get from a private doctor, can make appeal, and then reward start. So these kind of things go on. Sometimes people come with the certificate from Apex Institute, like All India Institute, and they challenge the court, and the honorable judge can ask you who is right, whom I should believe. So these things can keep on going. Red color contact lens, have anybody seen this red color contact lens in the life? It being used as a treatment of color blindness, right? So I have checked 2-3 candidates in my life. So if they are using one contact lens, one red contact lens in their eye, and they can give you the correct number on a SHARA chart. And he told me, sir, some place in South India, they give us the idea that we are treating congenital color blindness. Your color vision will be okay with this. I couldn't understand that how a person who is showing gross color blindness, the color blind defect, became totally normal. So then I examined eye. So then he found upon something very, very red. So I see first time, what is this? He said, sir, this is a treatment. So then we take out the contact lens, then we ask, and the person was again nowhere. So being a medical examiner, you have to be. You may, sometime a same person can come to you with this device. One time you declare unfit, then you make fit, and anybody can blame you that you charge 5 lakh rupees and give the fitness. Sir, last time you yourself went make him unfit. So be very careful. You can't remember everybody who you are failing or passing in your life. Ortho lens. These lenses are being used to correct some kind of refractive error for some some level. I don't know. I have no experience, but they are existing in the market. These lens to be used at the night, very minor kind of refractive error can be correct. Use at night, come in the morning, your vision will be almost with the required standard. So it is also there. So you have to find the solution of it, how you rule out of this. Corrective refractive surgery, we have to find out, though it's very difficult, but till we don't have the guideline, we are liable to take up, we have to rule out with all possible infrastructure. And malignance, I don't think you will understand about it. Sometimes patient try to refuse. I can't see 660 even. आप उसको ऊपर ये क्या लिखा हुआ अंग्रेजियों कह रहा मुझे कुछ पता नहीं चल रहा, हाथ भी नहीं दिखाई दे रहा, वैसे अपने आराम से चल के आ रहा है, हमारी समझ नहीं आ रहा है, वो अपना पेन आराम से निकाल लेता है, 10 का सिक्का उठा लेता है, लेकिन उससे पूछो 660 विजन साहब वो पता नहीं चल रहा क्या लिखा हुआ है. Same with the color vision. A person who is having normal color vision at time of appointment, after 10 years he don't want to work as a driver, he is fed up with this, he want to change his category and say, I don't see any color over here, I can't read any line. So these kind of challenge you have to be prepared for that, and we have find our own way how to handle these kind of. So in conclusion, we can say the medical examination is a very sensitive job. A wrong decision bears a legal foundation and likely to take up in future. Practical implementation in the field must be ensured before we framing guideline. This is very important. So whatever things you are planning and guiding and implementing must ensure that they should be freely available and freely implementable from this place to 1,000 kilometers away from Delhi, right? So candidates should not be debarred from job on the basis of unjustified parameter. That is our effort, but I am trying to do it. The modern technology of examination and treatment must be incorporated into the guidelines, and it should be reviewed every 5 years. So what we have suggested, Dr. Gajendra here, he was very senior officer in Ministry of Railway and a very intelligent fellow. We always say, sir, whatever parameters we are having, they should review at least 5 lines. We are not sure that they will be changed, but at least they should be reviewed with the present guidelines, and if the scope is there, we should change them, right? Thank you very much.